how early stage life science companies and investors can adapt to the new normal. So our topics we're going to cover: what is the current landscape? What are the adapting strategies? And how can investors identify and support resilient investment opportunities? We're going to discuss these things both from the early stage life science companies' point of view and from the early stage life science investors' point of view. At the end, again, we'll have a Q&A and discussion. Really would like to get audience input on this. There's a lot of things happening right now. We'd love to hear from you. So let me outline three areas we'd specifically like you to comment on, and you can comment again anytime throughout the presentation. Just add your comments using the Zoom Q&A function, and we'll come back around at the end. So three specific questions. Comment on anything, but here's three specific things that we'd love to hear from you on. What are your biggest concerns with what's going on right now? What upsides do you see for early stage life science companies or investors to the current administration's changes in policies? And how have you and or your organization adapted to the current situation? We're going to talk about these points from VicTech's and our portfolio companies' points of view, what we're experiencing, what we're seeing. Love to hear from you as well. All right. So first, understanding the new normal. There's one area that there's a lot of federal funding uncertainty right now. You're seeing that in the headlines. So here's Wall Street Journal headline: bioscience funding confusion threatens U.S. innovation. Nobel Prize winner David Barker says, with the current turmoil, China could surpass the U.S. in the near future. Here's an Axios headline: American progress in peril. The U.S. is freezing research funding, canceling projects, firing thousands of federal scientists, and creating an atmosphere of uncertainty that scientists warn could slam the brakes on progress. NPR, your RIF notice is not canceled inside a chaotic week of massive layoffs at HHS. Well, we're also seeing issues. We've seen in our portfolio substantial grant funding delays, if not cuts. So we've had portfolio companies that submitted non-dilutive grants, got a score well within the fundable range in terms of the pay line. That normally those grants would have been processed and funded by now, but they've been sitting there for months. We're seeing that across a broad swath of companies. We're also hearing that from other companies outside the VIC portfolio. There's confusion and concern about the indirect cost rate guidelines. So as you've probably heard, if you're tuned into these things, the universities' indirect costs have been slashed to 15%. There's some confusion about whether that applies to private companies or not. Most companies submitting new grants are taking the cautious approach of using a 15% indirect cost rate or less. However, that doesn't really match the actual indirect costs of the companies, nor does it match the indirect cost rates of the universities, the actual real ones. So that can create issues in terms of where does the overall funding come to support the work. There's also changed funding priorities. So one obvious example would be vaccines and maybe mRNA-based vaccines in particular. Despite the massive life-saving success of the COVID mRNA vaccines, these are falling out of favor based on the current administration's priorities. There's also the widespread layoffs include grant managers. So we're trying to get answers. Hey, what's the status of this grant? Sometimes we get radio silence for weeks on end, which used to not be the case. So lots of issues going on with the federal funding. There's also similarly concerns on the regulatory leadership changes and staff cuts. So Here's a Bloomberg headline: Vaccine makers plunge after FDA biologics head Marks steps down. And so that's referring to Peter Marks, who stepped down from the Center for Biologics Evaluations Research. But if you look at the FDA organizational chart, it's not just one person, it's massive changes, in the FDA organization. Similarly, well, sorry, I don't want, I do want to say there's not all negative outlook. So here's a Wall Street Journal headline: Trump's FDA sends a bullish signal to biotech. New Commissioner Marty McCreary's vow to back innovation might ease fears stoked by HHS Chief Kennedy. So that remains to be concerned, but or I'm sorry, that remains to be seen. But there are people who think that the FDA has been too slow, and maybe these changes are necessary to improve progress through the FDA. I am skeptical of that. We're losing a lot of experience. Michael, do you want to share any comments on this as well?
Yeah, happy to. So, I mean, from a first-hand perspective, one of our portfolio companies that I'm the interim CEO of, we're going to be sending out our Interact request, which is a pre-IND meeting. And that's pretty important for the company. We're not sure if that's going to be delayed. Typically, once you've made the request, the FDA has 75 days to respond. 21 days to respond with yes or no, and then 75 days to actually schedule the meeting. So we're hopeful that that timeline still holds true. But I guess we're kind of in a wait and see, or it remains to be determined how much the impact is going to be over the next, say, 6 to 9 months.
Yeah. And we've heard other feedback too from our portfolio companies, leadership in our portfolio companies. So, for example, one of our CEOs was at a meeting talking with some relatively high-level FDA people, and that those people reported to him that the FDA is demoralized, and that all these changes are going to negatively affect approval timelines. So we have concerns about that. It's something that I think every company in our portfolio has to plan around the uncertainty. We don't know what the effect will be yet in terms of the timelines. But there's a lot of uncertainty about that, and it makes sense to plan around potentially significantly longer timelines in the near future. Similarly, the trade policies are having major impact, influencing both supply chains and partnering opportunities. Here's the New York Times homepage from April 3rd. U.S. markets plunged from shock of Trump's new tariffs. When we're again talking to our portfolio companies and CEOs, hear this one from a major international trade show. He heard from a high-level executive and one of the strategic partners they've been pursuing that anger at U.S. is significantly affecting appetite to partner. So that's concerning. Other concerns, tariffs on equipment, reagents, and materials certainly increase expenses. Delays in the sourcing and the need to find new suppliers can significantly slow R&D and product development. We're seeing that in our portfolio. We've got companies that have components that are now priced non-competitively, which means that their products are non-competitively priced unless they find alternative suppliers. Those increased costs and uncertainties certainly can deter investors, and it can also give non-U.S. competitors an advantage. Tariffs can raise expenses for joint research, clinical trials, and biotech component exchange, and slow material sharing and disrupt production partnerships. So these are all concerns that we've seen directly in our portfolio companies. I don't know, Michael, do you have anything to add on this one?
I do not. I think you covered it very, very well.
Okay. So other policy impacts. Here's an interesting thing from the recent PitchBook newsletter. Interesting and a little bit worrisome. IPO roadshows will have to wait as institutional investors assess the impact of tariffs on their portfolios. That's easier said than done, given the complexity of both the tariff plan and mechanics of the global supply chain. And in that article, they included a quote from Sapphire Ventures president: "There's going to be a zero appetite to do acquisitions, and the IPO market might shut down. I don't think companies can go public." So that's a potential issue for the exit timing. The immigration policies are likely to hurt our science and technology talent pipeline. For a long time, the U.S. has been a magnet for top scientific minds for immigration coming to this country, and many of those people have made major contributions to the U.S. being the world leader in science and innovation. That immigration pipeline is being impacted. On the counter side, and we're looking at a more positive thing is, maintaining lower capital gain rates can spur investment. Certainly when the presidential campaign was going on, I had concerns about the Democrats' proposals to substantially raise capital gains, simply from a point of view of how that might affect investment in early stage companies in particular. So I think that's a concern that's off the table now with the new administration. So that's in my view a good thing. Deregulation and pro-business and climate could spur investment. For example, if the FDA process was simplified, but that's a balancing act. The FDA process, we want it to go fast, but we also want it to be rigorous and competent. So losing people with years and years of experience doing this, how long is it going to take to rebuild that infrastructure, all the people that have lost? And if you had an FDA process that was faster but not thorough, then ultimately you're going to have failed products get to market, and you're going to have damage to the life science community as a result of the effect on people's lives from products making it to market that shouldn't have made it to market. So it's going to be a balancing act there. Incentives to shift manufacturing and R&D back to the U.S. might spur investment. There might be opportunities for companies, well, there probably will be opportunities for companies to do more manufacturing, and the opportunities for investors in those type of companies. I will say, however, despite those potentially positive things, historically, investment tends to be reduced in times of uncertainty. And all these companies need capital to thrive and even just to survive. So that's, the overall landscape of uncertainty is a major concern. Will the current chaos mitigate? And before I answer that, I want to note this quote from the French president. What would the message be of having big European players invest billions in the American economy at the same time they are hitting us? We must have collective solidarity. So basically, it's pushing companies to pause investments in the United States. That's kind of similar to what we've heard directly from the feedback at the trade show. There's some uncertainty there. So going back to the question now, will the current chaos mitigate? Disruptions, I think are going to continue. I expect them to be at a slower pace. I think there's a blitzkrieg of changes that they tried to push through all at once, ranging from the massive staff cuts in the government agencies to the tariffs. Some of those could be potentially walked back from initial positions. even if they are walked back, the impact of those policies is going to be felt for many, many, many years, even if they're walked back soon. Adaptations will come, but it's going to take a long time to establish what that true new normal is. We are seeing a return of scheduled grant application reviews. That's a good thing. And the grant processing activities, things like requesting the just-in-time information and so on, that are important for the funding pipeline for the early stage life science companies are slowly resuming. I think international partnering agreements are likely to take different structures and approaches. I think long-term, everyone will adapt, but new supply chains will develop, but take time. The bottom line is that all companies are going to have to really be flexible and adaptable, as these policy shifts continue to occur.
And Calvin, can I add some additional thoughts on just this general topic?
Yes.
So one is glass is half full view, and one is glass is half empty. So the half full or more optimistic, one of the outcomes that we're seeing is a slew of announcements recently from large pharma companies, medical device companies, and other life science companies that they're investing heavily in building out capabilities, operations here in the U.S. I've seen probably a dozen or so recently. They're investing 500 million here to build a new research facility in North Carolina, or 130 here in Minnesota for a manufacturing facility. So that potentially is really incentivizing at least U.S. life science companies to pull back from offshoring, for lack of a better word, and make investments here in the United States. Now, the more pessimistic view is with regards to, yes, there may be short-term benefits or disruptions, but longer term, the view that I'm seeing, or we work very closely with universities. The bulk of the technologies that we create companies based on come out of research universities. And we're hearing a lot about, grants being cut and programs pulling back on the number of graduate students that they're admitting. And that is a talent pipeline. I think anyone would support the belief that these future PhDs, they play a fundamental role in going into the private sector and being heavily involved in research R&D at different types of life science companies. So that may have a longer term ripple effect that we're not going to see for 2 or 3 or 4 years, but in 5 to 10 years or 15 years, we're going to see a real loss in the talent pool that really enables innovation in industry here in this company. So just a couple of perspectives that I wanted to add to this subject.
Yeah, those are great points, Michael. Thank you. All right, so let's talk about some strategies for adapting. I said here that adaptability is going to remain essential. So what are some of the strategies for adapting? First thing is, and this is a risk both for the companies, the early stage life science companies, but also for investors in these companies, access to sufficient funding is always a risk, but it's even more so now. So what's the solution to that? Well, it's fairly obvious answer, but nevertheless worth spending some time on. Diversify your funding source. This is what we're doing within our own portfolio of companies. We of course have the advantage of having our own investor network, and that investor network is still as active as it's ever been. But even within our portfolio companies, we're using a diversification strategy, in terms of getting funding into our portfolio. I always tell our teams, especially the earlier stage companies, start with local high net worth individuals, engage with the regional investors. Those folks that have an interest in seeing the company be built out in the region are a great place to start. You can go from there to more organized angel investment groups. It's great if you can find ones that target specialized life, that target life science companies or have investors that have specialization and experience in life science and understand the unique challenges, but also the unique upsides, which are substantial, for life science investments. The sorry, before I move on to the next point, the other thing about angel investment groups, you get, there's you want to work towards syndication. A lot of the angel investment groups have really connected in recent years to pool together funding to get to investment levels that really allow a higher chance of success for the invested in companies. So working, with or approaching angel investment groups that have the ability to syndicate to other investors is important. The VIC Investor Network itself has partner affiliated angel investor groups that look at our deals. But that's a good strategy for any company. It's also for investors looking at investing in these companies, in terms of understanding what the opportunity is to bring in sufficient funding, into the investment opportunity. There's accelerators with investor showcases. So leveraging those type of programs that provide direct exposure to active life science VCs is something that more of our companies are doing as well. Family offices, especially if you can identify those with a history of investing in healthcare related opportunities. And importantly, if you can find warm introductions, it's, getting into the door at the family offices, getting them to take a serious look at what you're doing is often difficult. So finding good relationships, bringing people, onto your company's board with those relationships, people who can make warm introductions to you is important strategy. Seeking strategic partner funding. In our own portfolio, we work towards building alliances with established life science companies early in the process. We do that for a combination of reasons: for potential investment from the companies, for understanding how far we have to take a given technology before they'd be interested in acquisition, to identify the best market opportunities for some platform technology. So providing capital along with expertise. And finally, despite the cutbacks, despite the challenges I mentioned earlier, seeking non-dilutive funding, tap into grants like the SBIR and STTR grants and industry partnerships and other government programs. I think the answer to, the uncertain funding landscape is, work hard and take a very diverse approach to bringing in capital.
I saw, just to add to this, I saw interesting post on LinkedIn the other day, and it was from a young lady who had raised, I think, her first round of institutional funding for her company, and she was very open about how many people she approached and what worked. And so she said she approached 87 different investors. She ended up having 5 investors in that round. One of those investors was a warm introduction. The other 5 she actually met in person at events. And so I think it's very important to emphasize that in a post-pandemic, being able to go out to local, to regional, to national, and even international, fundraising, investor-related conferences in your area, presumably most of you are involved in life sciences, is very valuable. And you can meet folks from each of these different categories at those different types of events. So that's something that we should definitely focus on and help to address the challenges with raising funding in this, this new era.
Yep, good thoughts. Okay, so also adapting your business model and operations. So, the goal is to, optimize cash management and extend the runway. So some of the things that we're doing in our own portfolio, when we were more certain on the grant funding, we had perhaps some broader base of R&D going on, but we're prioritizing the most essential R&D and putting some of the uh, kind of second level R&D, to the side. We're also exploring, milestone-based financing. So we, for example, have one portfolio company that has a major sales and marketing agreement uh, pending with a large international life science company that would rapidly drive the revenue ramp. Um, and so, but the company needs to have capital to support that revenue ramp, even with the partner. So they're raising capital, but taking an approach where the capital raise is contingent upon actually closing that deal, which they're confident will close. But it helps ease the investor's mind that that will be done before the closing of the capital. So that's one strategy. Um, I think trying to keep your fixed costs down is really key. One way to do that is to leverage outsourcing and partnerships. One of the reasons keeping your internal fixed costs down is when you do have cash flow issues, if you've got a if you've got a large fixed cost, what do? You have to terminate people, you lose expertise. It's just very difficult to manage. If you're using outside partnerships, you can temporarily scale down, your work with the outside partner usually, um, but still have that expertise available when you get through that, cash flow hurdle. So using more outsourcing and partnerships is a good strategy. That's one that we regularly take with our companies anyway, but I think it's even more important now. Um, I think you have to take into account the commercialization strategy for your company. That includes thoughts on the trade and tariffs uh, affecting the supply chains. We're doing that. For example, we have a company that has a key component that presently sourced out of Canada. It's not made in the U.S., but now with the Canadian tariffs, if they stay at the level that they've been set at, that part will become non-cost competitive. So that company's having to adapt a combination of things. It's design, it's looking for alternative suppliers, it's looking at you know what to do if the tariffs stay in place, including things like potentially licensing the technology and making it themselves rather than buying it from Canada. So there's each company's situation is going to be different, but you've got to factor that in terms of adapting to the new normal. Uh, Again, this next one is something we already do. It's part of the venture studio model we use with companies across the country, with executive and development talent across the country, where we share these people across multiple of our portfolio companies. But you know, restructuring your hiring and talent acquisition practices to reduce fixed costs by using fractional executives, consultants, and remote teams. That's something I think will be important as we adapt to the new normal and potentially a fairly lengthy period of investment uncertainty. Also look at alternative revenue streams. So if you have a platform technology, consider, are there parts of that could be licensed to large companies now while you're retaining certain applications in-house? Are there joint ventures or specialized services you can offer based on the technology? And then monitoring FDA policy shifts and proactively engaging with FDA is more important than ever. It's always been important, but it's more important than ever. And taking advantage of programs like breakthrough device designation, which can potentially speed the FDA approval, I think become more important than ever. Although it's not clear, how the turmoil and changes to FDA are going to affect some of the timelines promised for companies, with breakthrough device designation or in general. But um, that's still, I think, an important part of how you adapt to the changes. Michael, any comments on this?
No, I do not have any.
Okay. So with that, I'm going to turn it over to Michael to go through discussion of identifying and supporting resilient investment opportunities.
All right, just gonna switch to sharing my screen. While I do that, just a reminder to the attendees to please post any questions or comments, any lessons learned, any personal experiences to the Q&A function on Zoom. Can you see that, Calvin?
Yes.
Okay, so I'm going to talk about how we, as a venture studio, have somewhat adjusted our approach to identifying and supporting investment opportunities. And some of this is going to be similar to what Calvin presented. There are certain themes we want to emphasize, but also how potentially some of the folks who are attending this webinar as investors may be thinking about how they find these investment opportunities and how they assess them based on these challenges that and potential upsides that we've identified. So first and foremost, is there an upside? Is there a silver lining? And although we've not really heard any statements or announcements about this, there is the potential of realignment by HHS and other federal agencies that funds innovation in this country, NSF, DoD, and others, to pivoting and focusing more on clinically relevant innovation. So innovation that's going to have a higher likelihood of improving human health, improving livestock health, improving agriculture, et cetera, in commercially relevant areas. Now that's again to be determined, but that could be one outcome here. There's also, as I'm sure many of you are aware, a mandate by HHS, and this is actually carried over into other federal agencies. We've seen this directly, of capping indirects at 15%. Most companies will go in at a 40% indirect rate. Some universities go in at 50% or higher. Some go as high as 90% indirects. And the indirects were not originally included in grants. I don't know, was that 40, 50 years ago, but were incorporated because universities were adding things like, power and facilities management and things that weren't really directly part of the grant. They just said, okay, let's just have a set aside rate of X amount, and that's going to cover whatever your overhead is to run the university and to enable this research to happen. It may be that because of the decrease in indirects or overhead to universities, that universities may become more proactive in marketing investable opportunities, partnerable opportunities to the outside world, and be less reliant on basic research grants carrying them through. Also, there could be an increase in the set-asides for the SBIR and STTR program because that is a real engine behind, moving the innovation ecosystem forward here, and it really helps with that valley of death, right? Basic research grants only get it so far. You have to really move the technology forward extensively to get it to a point where it's ready for, say, a Series A rounds or partnering with a larger life science company. How are you going to fund that? Well, if the SBIR, STTR program dries up, then that's going to be a real problem. We're hopeful that maybe these set-asides, which I think are currently 3.5% and 0.8%, don't quote me, for SBIRs and STTRs respectively, might increase. Renewed interest by R&D or in earlier R&D by the private sector. Over the past couple of decades, pharma, medtech, and other life science companies have really downsized their R&D, their discovery, early preclinical, even late preclinical work, and instead have relied on partnering or acquiring assets that were ready for the clinic or maybe had phase 1B, phase 2A data and some, demonstrative efficacy. Now they may be seeing that, well, a lot of these assets are going to start to dry up and go away because they're not able to raise the funding that they may need. Maybe we should be partnering earlier in the process rather than being too risk adverse and waiting until that asset gets to later stage development. And obviously, everything is fluid. We're hoping that in the second half of this year, the dust settles. We have an idea of what, things are going to look like for, say, the next 3.5 years. Obviously, a lot of these changes that have been proposed by the current administration are being challenged in the courts. So that remains to be seen as well. So how does that change how we as a venture studio and maybe you as a life science investor are evaluating these opportunities? The fundamentals still apply for us, right? So we don't invest in pre-existing companies. We invest in innovation that we source out of research universities, institutes, and national labs around the world. So that helps us really find the best technology possible. It also helps us, to a certain extent, offset, national peaks and valleys as far as policy changes, et cetera, because our most recent, for example, technology or most recent investment was in a technology that came out of Switzerland, the University of Lausanne. So we're looking for the best-in-class technology regardless of borders. But the fundamentals, sound science, it has to be well done science, well controlled. The numbers, it can't be on an N of one. It has to be statistically significant, has to definitively address unmet clinical and market need. It can't be a Me Too product. It really needs to be something that displaces either the current gold standard or there is no gold standard, and it takes up total or addresses total market white space. The credible inventor institution. So we make sure that we are leading the company when we form it. We apply the expertise to run the company for the startup period, which is typically 3 to 5 years, to get to a point where it's ready for that Series A or that major partnership. The inventor is not going to be running the company, but they are typically involved at least during the first few years. And are they going to be an asset as far as continuing to move the technology forward? Are they going to be presentable to investors, so forth and so on? IP also is critical. And then can we quickly and cost effectively move the technology forward to reach value inflection points? Can we do that in 12 months, 24 months? Can we do that for $500,000, $1 million, 1.5 million? What does our fundraising plan look like based on our initial seed funding that forms the company, some follow-on rounds of funding, but typically we will go after phase 1, phase 2 SBIR grants. And, the bulk of our companies have raised millions of dollars in those types of funding mechanisms from NIH and NSF and DoD and USDA and others. However, obviously certain types of technologies are going to find the current climate very challenging. Vaccines as an entire class. Okay, probably, but definitely mRNA vaccines are in the crosshairs. Exotic or unproven approaches, things that are, have not been administered to humans, and there's some, concern about what the long-term implications would be of this new technology. Technologies with non-US focused markets, right? The emphasis is on MAHA, make America healthy again. So there's a real, I think, obviously with the changes to USAID and other groups, de-emphasizing global health and emphasizing US health. And we're not going to get into a discussion about does that make sense or not, but that's just the reality. So focusing on technologies that address unmet need in US markets. Also, I think an emphasis on both civilian and military applications. So technologies, innovation that address both of those really allows the company that's developing that technology to tap into both those funding pools and not be reliant on one or the other. Calvin, please feel free to add any additional thoughts in any of these topics.
Will do, but no comment so far.
And then, you know, obviously, emphasis on US centric innovation, right, including sourcing and market opportunities. So we can't tap into federal funding, US federal funding, with a non-US technology. Well, maybe, but the obviously the company that we create has to be here in the US and the work has to be done here in the US. I think you're going to see that if you have even consultants or you have some involvement by a non-US entity, there's going to be additional scrutiny on that. So that's something to keep in mind. Obviously, technologies with quicker and lower cost paths to significant value inflection or acquisition, med tech instead of therapeutics. Does that mean we're going to de-emphasize therapeutics? Probably not, but we'll look for therapeutic opportunities that are further along in the continuum of development or really have a focused application area. And there's a question that we'll be addressing in a second about orphan indications or ultra orphan indications, and there's some, I think, credence to that. Also, non-FDA regulated assets, including enabling technologies. So we don't have to worry about what's happening at the FDA. So instrumentation, consumables, tools, things in the life science adjacent space, animal health, agriculture, food supply, and safety. Obviously, there's still a lot of concern about the US food supply stability and how that's going to be impacted in both the near term and long term. And something we've always been focused on, but will continue to emphasize, is pursue platforms rather than single asset, single application opportunities to limit risk. And I know platforms is an overused term, but what do we mean by that? So it is a technology that allows multiple new candidates, multiple new product opportunities to be created. Or, and this really isn't technically a platform, but this is sort of the same principle, it is an asset with multiple shots on goal. So, it has 4 or 5 indications that are large, have major revenue opportunity that we can go after. And that also then enables different pots of funding to be applied for. Maybe one has more of a warfighter application. Maybe one has a cancer NCI application. Maybe one is more infectious disease, so forth and so on. And how do we support our portfolio companies, these companies that we've created based on innovation, primarily licensed from US and to a lesser extent international sources? So as Calvin touched on at the beginning, we are a venture studio with a shared operational team model. So managing directors like myself will serve as the interim CEO from day one. I can pull in different subject matter expertise from our team. So if it's a therapeutic versus a medical device versus a diagnostic, I need somebody with clinical, preclinical expertise, somebody with regulatory, somebody with CMC expertise. We can bring that in on a shared basis and thus avoid having to hire these individuals for a sort of standalone company that is not in our ecosystem. And then the advantage is that if one of these companies has funding problems, funding challenges, has to pare back, these people can easily pivot and shift their focus to other portfolio companies. I'm not going to spend too much time on this, but we do, as an organization, have extensive knowledge and success raising both dilutive and non-dilutive funding. We've got extensive relationships with other seed investors, Series A investors, with corporate VC groups, with partners, family offices, etc. We've also written dozens of grant proposals, so we both are aware of all these different funding mechanisms. For example, one of my companies is a vaccine platform. We're tapped into all, RRPV, Biomap, MCDC, CDMRP, you name it, fill in the acronym. We know what the funding opportunities are, and we know how to go after DoD funding versus NIH funding versus other funding opportunities. We virtualize operations, so when possible, we'll use the inventor's university lab and or subcontract subawards to their lab or outsource to a CRO or a CMO, etc. Maintain that flexible culture, pivot quickly as necessary, explore all funding opportunities, leave no stone unturned. You won't believe how often we hear from other life science companies that they don't want to go after SBIR, STTR funding because it takes a lot of effort to write the grant and they won't know for 6 months if it's being funded or they won't get the money for 6 months. But that's just a self-defeating attitude. We will submit proposals every NIH cycle. We find, USDA or other agencies that are off cycle and make sure that we've got a constant stream because it's great to have that $3 million phase two SBIR. Oh, and that 1.2 million DoD contract. And that limits the requirement to go out and raise that dilutive capital. Oh, and by the way, your valuation continues to grow, and so you can wait longer and raise that Series A at a higher pre-money valuation. So with that, Calvin, let's go ahead and open up to Q&A. We've got some great questions that were posted and feedback that was posted on the Q&A board.
Michael, why don't I take the first one?
Yes.
Says, and thank you everyone who submitted questions. And anyone else has any questions or comments? Anyone else who has wants to share any of their experiences or has questions, please submit using the Q&A function. First one here is deal flow sourcing would be my biggest concern. How do founders/ideas find you or you find them? And what is the targeted number of companies started and offered for investment per year? So, as a venture studio, we don't invest in outside companies. We take a technology and form a company and invite inventors in as co-founders into the company that we form and put the team as, and typically the inventors, as I said, serve as technical advisors to the company. We usually identify the technologies rather than people coming to us, but we're open to people with technologies that fit our model coming to us, and they can simply reach out via a web form. But normally it's us with relationships with technology licensing offices. So we have relationships across the country and even internationally, as Michael said, and that are universities regularly sending us technologies that have become available for license. We also, ourselves scout university licensing websites to see what new technology has been posted, and IP clearinghouses such as In Part, which post technologies from a variety of sources. We are looking to form anywhere from 1 to 5 new companies per year. Traditionally, it's been 1 to 2. We actually would like to do more than that, but it's just been a matter of, the due diligence process is systematic and thorough, and it takes time. So typically 1 to 2 new companies have been making it through 1 to 2 technologies have been making it through our due diligence process per year to be the intellectual property foundation for new companies we form.
I'm going to go ahead and tackle this question. There's some great questions here. I don't think we'll have time to answer all of them, but hopefully can answer a couple more. This one is, do state-level funding agencies and programs such as CPRIT, which I think is the Cancer Prevention and Research Institute of Texas, serve as a viable alternative to federal funding? Will this encourage companies to headquarter in Texas, for example? Great question. So each of our portfolio companies will very aggressively pursue local, state, regional funding. And these companies can be placed anywhere in the US. Sometimes it's based on where the interim CEO is, sometimes it's based on where the technology was licensed from. But for example, two of our companies came out of Colorado, and both of those companies have received matching grants from the state of Colorado's Advanced Industries program, which is $250,000. It's a match 1 to 2 of non-state funding. So if you have a $500,000 SBIR, that serves as the match. VIC is headquartered in Arkansas, and so some of our companies are based in Arkansas, and we've tapped into an SBIR match, which is 50K for phase 1 and 100K for a phase 2. I would also say that yes, there are NGOs, foundations, and other sources of funding that look a lot more appealing now, based on the current situation. So Bill and Melinda Gates Foundation, if you're in one of their areas, their focus areas, Disease Foundation, Cystic Fibrosis Foundation, things like that, really should also be investigated. As far as the question of, will these types of state-based funding mechanisms attract companies to that state? It's a possibility. I guess it depends on how much funding is offered. How viable is it for that company to relocate to that state? I know for a while there were a lot of there's a lot of funding coming out, some California programs. Whether or not that enticed companies to relocate to California, or if it's focused on companies already in California, I don't know. But yeah, again, this really speaks to leaving no stone unturned and looking at any funding opportunity. And then if you get the award or you're offered the opportunity, really, making the decision on, does that make long-term sense for your company?
Let me add to that a little bit. I think the high level answer, is state level funding programs can absolutely make a difference, both in terms of the success rate of companies being developed in their state, but also in terms of attracting companies. So as one example, Maryland has a very significant investor tax credit for Maryland-based companies. And so we actually have one of our portfolio companies that is presently planning to relocate to Maryland because it can raise substantial capital there by taking advantage of that very substantial investor tax credit. So yes, I think the state programs, I'm not sure they're really a real alternative to federal funding, but they certainly can have an impact, and I think that is another good thing that all companies should be looking at. Where can they get state support?
And
Um,
Alvin, I think we do need to wrap up.
let's take at least one more question. So there's one here. Much has been made of the shift for most early stage investors to more de-risked opportunities. This has led to less funding between SBR/STTR and Angel VC, typically used for MVPs, minimal viable products. Are you aware of any new or growing sources for this? I would say that the increased activity in venture studio models is a if not new, it's certainly a growing source for funding. We've taken technologies. I mean, typically this is not the case, but we've taken technologies that are just at the concept stage, no prototype created, just a provisional patent filed. And one of our companies that we took from that stage, has now had over $100 million in venture capital funding, and is rapidly taking over market dominance in its segment. So, as a venture studio, we will take companies at earlier stages than others, but that's a different model than a inventor founding their own company, for example. So, but all right, we are a little past time. Sorry we didn't get to answer all the questions. Thank you everyone for your participation. I hope you found this helpful, and please reach out if you have any additional questions or information you'd like to get. Thank you.
Thanks, everyone. Take care.
Bye-bye.